We do not yet have a quorum. I welcome my vice chair and the members. Will begin as a subcommittee and take up the items on the file. Mr. Swanson's AB 17 having to do with human trafficking is sent to the floor under Rule 28.8. Let's see. Who do we have? Ms. Buchanan is here. We'll go to you then. Welcome. Members will go to Assemblymember Buchanan's items AB 483 and AB 1006. Go right ahead. Welcome.
Thank you, Madam Chair. I appreciate the honor to present the bill. AB 483 is a simple bill. It directs the Workers' Compensation Insurance Rating Bureau to create and maintain an online searchable database for employer workers' compensation data. Currently, individuals must request this information in writing or email and pay a fee of $8, and oftentimes it takes up to a month to get that information.
Oh, he's got it.
In the information age, it makes sense to provide this information online. 33 other states do so, and Florida and Mississippi have reported savings by providing access to the public for this. It received a unanimous vote on the Assembly floor, and I ask for your aye vote today.
Thank you very much. Is there testimony in favor of AB 483? Welcome. Go ahead.
Yeah, okay. Madam Chair and members, Laura Alarcon with the Department of Insurance. The Department supports this measure because the transparency it provides will benefit employers and employees and help deter insurance fraud. We urge your aye vote. Thank you.
Very good. Next, please.
Lori Kammerer, Small Business California. We heartily support this bill.
Thank you. Any additional testimony in favor? Is there opposition testimony? Members, are there any comments?
Madam Chair, I appreciate what the author is attempting to do, but I think this creates a problem. Talk about transparency. I think there's another factor, and that's detrimental reliance. To the extent that that data is not correct or out of date, and then you get folks who go there and rely on the information that's presented. And the interesting thing about that is you have no one to sue based upon your reliance, detrimental reliance. And so I would encourage my colleagues to vote no this morning, even though the Department of Insurance seems to think it's a good idea, but frankly, we think that they're just mistaken.
Thank you, Senator Cox. I would note that the expenses in the bill are part of the workers' access to the database. Hopefully that would improve, that would ensure the timeliness of the information, but we'll have to see. I would like to take a roll call, please. Now we have a quorum. Please call the roll.
Kehoe?
Here.
Kehoe here. Cox?
No. Oh, I'm here.
Cox
Yeah.
here.
He is here.
Corbett?
I'm going to insist on that.
Corbett? Didham here. Hancock? Leno?
Here.
Leno here. Oropesa? Price?
I was just checking my no button.
Runner?
It seems to be working.
Walters? Walters here. Wolk?
Here.
Wolk here. Wyland Yee?
All righty. We have a quorum.
Madam Chair?
Yes.
I move the bill.
Thank you very much, Senator Leno. Let's hear from Finance before we take the roll, unless there's other comments.
The Workers' Compensation Insurance Rating Bureau estimates that the creation of the website could cost between $400,000 and $600,000, and ongoing maintenance would be approximately $40,000 annually.
All righty. We have a motion from Senator Leno. Do you have a comment, sir?
Yes, just a support comment. Jeremy Smith on behalf of the California Labor Federation in support.
Thank you. We'll call the roll, please.
Kehoe?
Aye.
Kehoe, aye. Cox?
No.
Cox, no. Corbett? Corbett, aye. Didham?
No.
Didham, no. Hancock? Leno?
Aye.
Leno, aye. Oropesa? Price? Runner? Walters? Walters, no. Wolk? Aye. Wolk, aye. Wyland? Yee?
Runner, no.
Runner, no. 4-4.
The vote is 4-4. We'll place it on call. Ms. Buchanan, are you going to present 1006?
Yes, I would
Go
like
right
to.
ahead.
Thank you. 1006 is a bill that is designed, that asks the state when it's relocating or purchasing office buildings of 10,000 square feet or more to add to the list of factors that it considers the people that it's serving, the location of the people it's serving, and also the residence of the workers. And it's a bill that's consistent with AB 32, with SB 375, and it's consistent with what we ask local governments to do already, and I believe the state should lead by example in this regard, and it certainly, makes sense from a customer service point of view. We worked with DGS when this was going through Assembly Appropriations, and we took out the requirement that a traffic study be done because I noticed this was referred to in your reference. So it seems to me that this is a pretty simple bill. You could look at the zip code of where all your employees work to determine the location there, and it should be very low cost and very simple to do. And again, those are just two more additional factors.
We'll go to your witnesses, Ms. Buchanan.
Thank you.
Madam Chair, members, Jason Gonsalves representing the City of Elk Grove. As the author, Assemblywoman Buchanan, mentioned, we've been working with DGS. We feel that this legislation is consistent with SB 375 and AB 32. And the City of Elk Grove has a number of residents leaving Elk Grove commuting, and this is an effort to try to tie state office facilities closer to where people are living. We took an amendment in Assembly Appropriations Committee limiting the application to 10,000 square feet or more. So we'd hope that would keep us off suspense, but I understand that the analysis says may. So we'll see where the chair is. Thank you.
All righty.
Madam Chair, Justin Malone on behalf of the U.S. Green Building Council and Northern California, very much in support of this bill.
Any additional testimony in favor? And is there any opposition testimony? Finance, do you have a comment?
We don't have a file on this measure.
As the witness pointed out, it does say may meet the criteria. Staff looked into this in detail. At this point, the way it is constructed and the data that we have, it is hard to tell whether there would be cost savings or costs. And but I think there is some valid issues here. I know Senator Cox is a co-author. I'd be happy to take a motion on the bill.
So moved, Madam Chair.
Senator Cox moves the bill. Roll call, please.
Kehoe?
Aye.
Kehoe, I. Cox?
Aye.
Cox, I. Corbett? Aye. Corbett, I. Denham? Aye. Denham, I. Hancock? Leno? Aye. Leno, I. Oropeza? Price? Runner? Aye. Runner, I. Walters? No. Walters, no. Wolk? Aye. Wolk, I. Wyland, Yee? 7-1, it's out.
7-1, that bill is out.
Thank you,
Ms. Buchanan, so it goes to the floor. Members, I don't see any Assembly members present. We'll go to the wave presentations and take those up. I would encourage Assembly members to make their way to 4202 and present their bills.
Of course, let's just go to the suspense item. If they don't show up, let's just adjourn the committee and be done with it.
Well, I don't know if I want to go that far, Senator Cox, but I do appreciate.
Well, I mean, there's an obligation. We have said to our members, you need to be here. And if we're going to ask our members to be here, we then need to ask the presenters to be here to present. And to the extent that they're not, we got to just shut down.
We will take that under advisement.
It's a good threat anyway.
Yes. And we'll go to the wave presentations. There are three members: Mr. Fuentes, AB 526, Mr. Tirico, AB 744, and Ms. Hayashi, 1386. But now we have an author. Mr. Adams, step right up. And Mr. Adams, the one item, 1184, go right ahead.
Thank you very much, Mr. Chairman. Senators, it's a pleasure to be with you this morning. 1184 does deal with an issue that is potentially going to suspense because of an amendment that was taken in Policy Committee over my objection that would require the Public Utilities Commission to define the term government purpose. I strenuously object to the notion that that be in there, and I would respectfully request the opportunity to allow this bill to move forward with the commitment that we will seek to remove that provision on the floor of the Senate. The reality is this bill seeks to do nothing more than allow each of us as members to engage in the practice of the teletown halls. That is the opportunity to communicate directly with our voters. This is a practice that the Congress is currently engaging in, and a practice that we not too long ago did as well. But through a strange provision and interpretation of the law as it relates to California, we have been told that we can't do this. This bill seeks to clarify that rule and allow the members of the legislature to engage once again in this very expansive and very available opportunity to communicate directly with our voters on a person-to-person basis. I might note as well that this is not robocalls, members. This is a call where you are actually on the line speaking with your constituents, and your constituents have the opportunity to speak with you. I find it highly, highly unlikely that there's a member of the legislature that is not eager to have another tool at their disposal to move forward with the ability to communicate directly with their voters. Members, I believe this is a very noteworthy bill. I believe the provision that the PUC defined the term governmental purpose is simply there to ensure that this thing goes to suspense where it can die. I think it's an unfair provision and a definition that does not need to be defined, as the courts have sufficiently done so, as long as that definition or that term of art has been a part of our law, which I might add has been from time immemorial. Members, I think very strongly that this bill is an important piece of legislation that needs and deserves to go forward, and I would ask for your strong consideration of it.
Thank you, Mr. Adams. This bill, as you explained there, more closely resembles a telephone town hall than the robocalls.
That's correct.
It's a two-way communication.
Yes, that's correct.
So I think it's a worthy idea. I know the congressmen use it all the time in San Diego, and I know my staff has been called by the local congressmen around here to participate in these discussions. I do have a concern if the policy committee added the language regarding governmental purpose. If we amend that out, how do you expect to define address that concern about the definition and then what's allowable and what's not?
I absolutely appreciate the opportunity to answer that question. I think the courts are more than sufficient at defining the term. Remember, that term has been a term of art that has been used in our laws for in multiple purposes throughout the rules that govern our ability. Currently, we're all governed by the rules of what is and is not governmental purpose, and that is not a defined term. So when you engage in your FPPC filings, for instance, you're told specifically to identify that which has a governmental purpose for determinations of whether or not your tax dollars are being spent on those purposes. Yet, without that definition, we've all found a way to maintain a modicum of respect and decorum for the law and not abuse that privilege. The fact of the matter is it does not require us to define that. If and when there should ever be a challenge, the courts are more than sufficient at making those determinations about what and what is not governmental purpose. And for that reason, I believe it's not necessary to charge the PUC with the responsibility to do so.
Madam Chair,
Senator Cox.
Madam
yes.
Chair, I understand this is scheduled for suspense.
At the current time, with the costs that are associated with the PUC effort, yes, it meets the criteria for suspense quite clearly.
Then I suggest, Mr. Adams, that you'll have at least 2 weeks to make your case to the staff as to why you should be, whether or not it gets out of suspense. When is that next hearing?
It's Thursday, the 27th.
As in this coming?
That's right.
This coming Thursday. So you got 3 or 4 days to.
And Senator Cox, we have already drafted language and sent it down to Ledge Council with the amendment to remove the responsibility of the PUC, with the hope that we can convince the staff and Madam Chairwoman that it is the appropriate course of action to move forward in that regard.
Don't you have a problem when it goes back for concurrence?
It is, but I'd rather address that problem at that point. Again, I think it was inappropriate to include that language, and it was done so over my objections to begin with.
Which committee added it? You're in Assembly?
No,
Yes, Senate EUC.
Senate.
Senate Energy. Let me chime in here, members. Mr. Adams, I think that's the right way to handle it. Let's send the bill to suspense. It gives you the time to get the amendments back from Ledge Council and staff the time to review it. We may be able to clear it up that way.
I think that's
Otherwise, you are going to take a trip back through memory lane. And, with the calendar the way it is, I think that would jeopardize the bill, too. So if you, unless there's further discussion, without objection, let's move it to suspense and have staff work on it with you.
I appreciate that commitment. Thank you so much.
Thank you, Mr. Adams. Appreciate you being here in a timely manner. Finance, did you have a comment on that bill? We'll take it under advisement with suspense. Mr. Adams?
The PUC didn't provide us with an estimate, but we were just concerned that to the extent it would increase costs of the PUC above and beyond what's in their budget, it would cause pressures and potential problems.
Thank you. Members, I have to say, I didn't ask for public testimony on AB 1184, Mr. Adams' bill that we just sent to suspense. Is there any public testimony for or against AB 1184 having to do with automatic dialing devices? Seeing none, good. We didn't miss anything. Mr. Delatorre, I think you're next.
Bright over there. You're looking awful bright.
And Mr. Delatorre, you have the one item, AB 730?
Yes.
Go right ahead and begin.
Thank you. Madam Chair and members, AB 730 would require a health insurer that unlawfully engages in post-claims underwriting be liable to the state for a civil penalty to be fixed by the insurance commissioner in an amount not to exceed $5,000.
This is a due pass, members.
If the issuer knew that the act of post-claims underwriting was unlawful, the civil penalty would be fixed in an amount not to exceed $10,000. Under current law, the commissioner has jurisdiction to fine only $118 per violation. You get a speeding ticket and it's over $300. This is affecting people's health care, affecting people's lives. The Department of Managed Health Care, on the other hand, has jurisdiction to place unlimited administrative fines on health plans for unlawful acts and civil penalties up to $2,500 per violation. That gives you a sense of the disparity. We have taken amendments to ensure that the first $118 that originally went into the general fund stays in the general fund. Therefore, there are no costs to the state, but positive revenue to Mr. MIP, which funds the uninsurable.
Thank you, Mr. Delatorre. You have your witnesses. Please go right ahead.
Madam Chair and members, Laura Alarcon on behalf of the Department of Insurance. As a sponsor, the Department urges your support of this measure. Illegal rescissions can wreak financial and emotional havoc on policyholders who believe and rely on the fact that they have health insurance. The current $118 penalty amount sends the wrong message, that is, that these violations are minor. Raising the penalty to $5,000 for each violation and $10,000 if the act was done knowingly sends the right message. Illegal rescissions are noteworthy and should not be tolerated. AB 730 only has minor fiscal impact on the department. We urge your aye vote. Thank you.
Thank you. Next, please.
Beth Capel on behalf of Health Access California, pleased to be here today in support of this measure.
Thank you. Next.
Gary Passmore with the Congress of California Seniors. This is an important bill to us, and we urge your aye vote.
Thank you. Additional testimony in favor?
Chad Silva, Latino Coalition for Healthy California. We're in support of the bill.
Thank you.
Randy Hicks with the California Alliance for Retired Americans, in strong support.
Thank you. Additional testimony for or against? Opposition testimony?
Jason Gappar on behalf of the Association of California Life and Health Insurance Companies. We have opposed unless amended position on the bill. We're okay with the increase in fines. We believe $118 isn't appropriate either. However, we don't think the bill really has two standards as it's written right now. The $5,000 and the $10,000 is really, you can't tell the difference. That's why we're proposing either a knowingly standard for the $10,000 or an intentional standard for the $10,000. We believe that will be more in line with the other sections in the insurance code. Thanks.
Thank you. Additional testimony for or against finance? Do you have a comment?
We concur that the bill would provide an undetermined increase of funding to Mr. MIP. However, we have two concerns. One, that generally penalty revenue does go to the general fund, so increasing penalty revenues and directing it someplace else would be a loss to the general fund, potentially. Although we do acknowledge the original, the 118, the first 118 would remain at the general fund. The second concern that we have is that the bill does not align the Department of Managed Health Care's post-claim underwriting penalty provisions, resulting in a statewide inconsistency.
Thank you.
Madam Chair, I move the bill.
Thank you, Senator Leno. We have a motion, members. Are there any comments?
Madam Chair, let me just say that we do think it's important that there be some consistency. The two departments, managed care as well as the other Department of Insurance ought to have the same rules and regulations that they're playing by, and to have an unlevel playing field just frankly doesn't make any sense.
Thank you, Senator Cox. Any further comments? We have a motion by Senator Leno. Will you call the roll?
Kehoe?
Aye.
Kehoe, aye. Cox?
No.
Cox, no. Corbett? Corbett, aye. Denham? Denham, no. Hancock? Leno?
Aye.
Leno, aye. Orapeza? Price? Price, aye. Runner? Runner, no. Walters? Walters, no. Wolk? Wolk, aye. Wyland? Yee? Yee, aye.
Better do them all.
6 to 4. We need one more vote.
6 to 4, that bill is on call. Do we have anything else on call now?
Yes.
Okay, let's try to,
Yeah, let's do this one here.
if we have enough members, let's dispense with them as soon as we can. Okay. Ms. Ma, I think you're next. AB 517, Safe Body Art. Welcome. This is a due pass, members.
Thank you, Madam Chair, members. Assembly Bill 517, the Safe Body Art Act of 2009, provides statewide standards for the regulation of the business of tattooing, body piercing, and the application of permanent cosmetics in California. This bill has no general fund cost attached to it. This bill requires that all body art facilities acquire a permit to operate with specific requirements for qualification and for individuals to register with local jurisdiction enforcement. AB 517 has the support of numerous local public health and environmental health agencies and numerous body art industry groups. With me today is Justin Mallon on behalf of the California.
Senator moves the bill, Ms. Ma.
Thank you.
Would you like to go to your witnesses?
Yes,
Go right ahead.
Dr. Justin Mallon.
Madam Chair, very briefly, Justin Malone on behalf of the local environmental health directors. We co-sponsoring this measure with the health officers of California, and it's long overdue. We don't have regulations in place to protect what is a burgeoning industry. We had the support of the industry itself and the health officers in the state, and we urge your aye vote. Thank you.
Thank you. Additional testimony in favor? Is there any opposition testimony? Finance, do you have a comment?
We believe the costs would be minor and absorbable.
Thank you. Members, are there any comments? Yes. Senator Denham.
Can you briefly describe the amendment that was taken dealing with ear piercing? And
Yeah, maybe Justin can talk about that, but we wanted to work with the industry. There's a lot of ear piercing that goes on at stores like in the mall, and they were concerned that now if people wanted to get their ears pierced, teenagers or others, they would have to go to a specific tattoo parlor to do that, and that's not the intention of this bill. So, Justin, perhaps you can.
So ear piercing at a jewelry store in the mall would still be allowable?
It's still allowable, yes.
Great.
This is the exact opposite of that. It wouldn't be allowed, right?
Look at the bill.
Why wouldn't we want that? So is the issue then with the department stores that they actually have to go back in and do some type of new registration that currently they don't have to do?
That's correct. Originally, the bill would have included all ear piercing under the rest of the body art or piercing. And the bill only exempted the lobe of the ear, which is the most commonly pierced part of the body with a piercing gun. The concern was hinged over two issues. One is currently in malls and kiosks, there is no control or regulation, no sanitation requirements, no training. And there have been at least anecdotal concerns, and some of the health officers confirmed the concerns that not only is there potential problem with infection, but also that the guns actually destroy the cartilage in the ear if they're used above the lobe of the ear. So the original bill included them as part of the body piercing with full regulation, but subsequent amendments removed the full regulation and limited to sort of nominal registration and requirement for sanitation in the mall. So they are handled differently, but there is a minimal amount of oversight with the local agencies.
So in the department stores, they still can't do the upper ear.
They can do the entire ear, but they are subject to some minimal sanitation requirements, and they do need to be registered so we can keep track to see if there are any concerns with the operations. So the piercing industry, which is represented by the largest manufacturer of the guns called Studex, was involved in those amendments, and they have signed off on the bill, so they don't have any opposition to the bill as it currently is written.
Thank you.
Can I just, let me be clear, I want to be clear. The lobe and the upper ear are treated the same?
Correct.
Okay.
The bill originally only exempted the lobe, but now the upper ear can be pierced with a mechanical device, but only the ear, no other part of the body.
Understood.
And not this little flap in your ear.
Pardon me?
And not this little flap in your ear.
Okay, the front part, okay.
Right.
The bill before us, though, it treats the entire ear differently from the body of the bill, so to speak, for the
That's
tattoo
correct.
artist.
And
Okay.
it does allow for the upper edge of the ear to be pierced with a gun.
All righty. We have a motion by Senator Woke, was it? Is there any further discussion, members? We'll call the roll, please.
Kehoe?
Aye.
Kehoe, aye. Cox?
No.
Cox, no. Corbett? Corbett, aye. Denham? Hancock? Leno? Oropeza? Price? Price, aye. Runner? Walters? No. Walters, no. Wolk? Aye. Wolk, aye. Wyland? Yee? Yee, aye. 5-2.
5-2, that bill's on call.
Thank you.
Thank you, Ms. Bond.
Thank you, member.
Miss, let's see. Ms. Lowenthal, yes. You have two items? They're both noted for suspense. AB 1243, would you like to start there?
I understand this is a candidate for suspense.
Yes.
I look forward to working with you and your staff.
Thank you. This is the Strategic Area Freeway Task Force. Is there testimony in favor?
Chair and members, Mark Watts representing the Gateway Cities COG, 27 cities in southeast LA County. We're sponsors of this legislation and urge your support for the measure. Thanks.
And Madam Chair, Chris McKaylee on behalf of the Los Angeles County Metropolitan Transportation Authority, which adopted a support position. Thank you.
Thank you. Additional testimony in favor? Is there opposition testimony? Seeing none, Finance, do you have a comment?
The bill would create unknown but potentially significant costs for the Business Transportation and Housing Agency to provide administrative support for the task force, including the preparation of the annual report, stakeholder meetings, and program development.
Members, this is earmarked for suspense. Without objection, it'll go to the suspense file, and Ms. Lowenthal will take up AB 1340 on special absentee voters.
Thank you, Madam Chair. AB 1340, sponsored by Secretary of State Deborah Bowen, gives election officials 6 additional days after Election Day to tally mail-in ballots of military and overseas voters as long as those ballots are postmarked by Election Day. I understand the bill is recommended for suspense, and I think it's important to note that the cost of tallying these additional ballots is well under $50,000. The major cost driver in this bill is the reporting requirement. Currently, counties report their overseas voter data to the Secretary of State for every federal general election. I hope that we can draft amendments to streamline the reporting currently in this bill by merging with those existing requirements. I believe doing so would eliminate the added costs that made this a candidate for suspense. This is an important bill to ensure we enfranchise our men and women overseas. I look forward to working with the committee to reduce the costs of this measure.
Thank you, Ms. Lowenthal. Witnesses?
Thank you, Madam Chair and members. Rhonda Pascal on behalf of Secretary of State Deborah Bowen, the sponsor of this measure. Again, we look forward to working with your staff, Madam Chair, as the bill is on suspense to lower the costs. We believe, as Assemblymember Lowenthal indicated, that the reporting requirements can be revised in such a way to have a substantial savings there. So respectfully urge your support and consideration when the bill's on suspense.
Thank you. Any additional testimony? Is there opposition? Finance, do you have a comment?
The Department of Finance is opposed to the measure due to the mandate costs. Current mandates dealing with absentee ballots are about $22.6 million annually, and this bill, we estimate, could result in mandates between $58,000 and $260,000.
Thank you. Members, this is a suspense candidate. If there's no objection, we'll move it to the suspense file. Thank you, Ms. Lowenthal. Appreciate you being here. Oh, Assemblymember Cook, thank you for joining us. You're up. Members, Mr. Cook has two items, AB 830 and AB 1325. Do you want to start with 830?
830.
Drugs and
yes,
devices.
Okay. As cancer treating physicians, medical oncologists rely heavily on off-label drugs to treat their patients. Off-label drug use is the practice of prescribing medication for treating a disease or condition that is outside the scope of a drug's original approved use. This bill updates the off-label compendium in California Code, having it out to date. A list of compendia risks non-payment for the medical oncologists and risks a lack of access to the most cutting-edge innovative therapies to cancer patients. And I might add, since I personally had two experiences with this, also leukemia patients. We have accepted amendments offered by the Department of Health Care Services and have submitted these amendments to your committee. With the amendments, the bill will be of no additional cost to the state. The bill has not yet received a no vote. With the amendments, DHCS has removed its opposition. I ask for your aye vote on this measure. I have my witnesses here with me today.
Thank you.
Chris Rosa, representing the Medical Oncology Association of Southern California and the Association of Northern California Oncologists. We're the co-sponsors of the bill, and this is an important technical cleanup bill. We ask for your aye vote.
Thank you. Any further testimony in favor or opposed? Opposition testimony? Finance, do you have a comment?
The Department of Health Care Services advises that the bill could increase Medi-Cal pharmacy costs due to an expansion of off-label indications. In addition, some of the off-label drugs may not be eligible for federal funds, thereby placing the entire burden on the state. The Department of Health Care Services has advised the author's office and us that there are amendments pending, but we have not had a chance to review these to see if it fully addresses our concerns.
All righty. The committee has recommendations. With those recommendations, the costs would come out of the bill. We would authorize compendia that are approved by the Medicaid program. So this is eligible for a due pass.
So moved, Madam Chair.
Thank you, Senator Cox. Any comments, members? We will take the roll call then.
Someone move it.
Mr. Cox moved the bill.
Okay. Kehoe?
Aye.
Kehoe, aye. Cox?
Aye.
Cox, aye. Corbett? Corbett, aye. Denham?
Aye.
Denham, aye. Hancock? Leno? Oropesa? Price?
Aye.
Price, aye. Runner?
Aye.
Runner, aye. Walters?
Aye.
Walters, aye. Wolk? Wolk, aye. Wyland? Yee? 8-0.
8-0, that bill is out. Let's see. Mr. Cook, you have another item on tribal customary adoption. Go right ahead. Your witnesses can come up.
They're on the way, but we have plenty of witnesses, so I'm lining them up. AB 1325.
We just need the good ones.
Mine are all good. AB 1325 provides an alternative to the traditional method of adoption by adding the option of customary adoption. Customary adoption is defined as a traditional tribal practice recognized by the community which gives a child a permanent parent-child relationship with someone other than the child's birth parent. In traditional adoption, termination of parental rights of the biological parents must occur for a Native American child to be adopted. Unfortunately, termination of parental rights can be detrimental to Native American cultures. It does not embrace the rituals many tribes use in making rituals and does not embrace the reclaiming of cultural traditions. Under this bill, customary adoption will provide an option for Native American children. It will not replace traditional adoption, has the same safeguards built into traditional adoption, and will result in a placement that satisfies the needs of the child while taking into account the place of that child within a tribe. Now, your committee analysis notes that it's unlikely that more than 10 adoptions will occur under this bill in any year. In the conversations we had between interested parties, the real number, at least from what we've garnered, is 3 to 4 per year. Due to the small caseloads and the fact that for state agency, the procedure is very similar to traditional adoption, we believe the burden on the state is minimal. Long-term costs will be virtually non-existent and perhaps will result in a savings as we move children away from the foster care. One of the things we had there, we had the 3 years with the, I believe you have that in your analysis, and one of the ones which caused a flag to go up was $50-something thousand for the second year. We are asking the committee to look at the fact of that the first year is 34, then we're looking at 59, 31, and we're looking for an average that would bring it down below 50,000, the threshold that we're talking about.
Thank you, Mr. Cook. Let's hear from your witnesses and the members.
Thank you, Madam Chair and members. Kathy Sunderling with the County Welfare Directors Association. In support of the bill, we've worked closely with the author and his sponsors over the last 2 years as this bill has been moving forward to iron out any wrinkles that might be in this new system. It's, as Mr. Cook indicated, very similar to existing adoption procedures. This is just a more culturally sensitive option for these tribal children that both will engage them and enable them to have permanency with an adoptive parent, but also respect the customs of the tribes to not completely terminate parental rights, which is what we would do in an adoption of a non-Indian child. From a fiscal perspective, adoption tends to cost less in the long run because you don't have the social workers anymore, you don't have the court costs anymore. So those are both positive things for the state. And from a policy perspective, it's the right thing to do for kids. So we urge your consideration while it's on suspense.
Thank you. Next, please.
Good morning, members. Phil Wyman with the Chemehuevi Indian Tribe.
Welcome back,
This
Mr.
is,
Wyman.
thank you, Madam Chair. It's good to see all of my former colleagues. This is a really important bill. I've worked with Indian country for many, many years, long before gaming was even there. But you know, Indian cultures have had ongoing issues and difficulty with intoxication. You will find that there are many young, very young children who, as a consequence of some behavior that everybody prays can be achieved and that can be improved and focused on, you often find in a tribal setting that a young child suddenly finds himself or herself without a parent. I, in no sense wanting to go into any detail, had a very sad situation with a tribe with which I'm quite close, where in a drunken stupor, husband took the life of mother of a very young child. Now, there are generations, there are elders in that tribal setting that under those circumstances, since, as one of the great chancellors said, the mind of man runneth not to the contrary, they took care of their own. This is all that Mr. Cook's bill is doing. At first, there were a lot of questions from both sides of the aisle, but if you look at the broad spectrum from left to right, reap to dim, supporting this, you soon see that that this is something that is part of being sovereign. And if Indian tribes are sovereign about anything, they ought to be able to take care of the young innocents that find that there's no parent there, as opposed to sending them to some social worker. I mean, this is the great deceit and the great injustice that sent Indians in prior generations to schools so they could dislearn their culture, dislearn their language, dislearn everything. So Indian country feels very strongly about this. I think everybody does who's seen it. This opens an opportunity for these young children to be taken care of by the tribe, consistent with state law and consistent with what is right. So it is very good.
Thank you, Mr. White.
And I want just on the fiscal issue, because I know these issues, they're amendments that are being looked at right now that the author hasn't seen. But 34 plus 59 plus 31 divided by 3 is under 50,000.
Mr. Cook, are you contemplating amendments or not?
Sorry?
Are you contemplating more amendments?
The ones that the Senator referred to.
We haven't had a chance to review those.
Well, just to focus on that, these are the amendments that came most recently where these figures are identified. And they've apparently asked the chairman for some more amendments. Of course, the department's looking for ways to preserve employees, and I can understand that from the executive department. But I would say, since these numbers are kind of out of the clear air, and 50,000 is the set-off, if you add these three together, you're under 50,000. So let's move forward.
Thank you, Mr. Wyman. Why don't you give us the information that you have, and then we can have a response. Next, please.
Kimberly Clough. I'm an attorney with Saboba Band of Luisteño Indians, and I'm here in support of the bill. In looking at the numbers presented by the California Department of Social Services, the tribe believes that this is not truly a new program as described in the analysis, and that what's important to understand is that tribal customary adoption really is a new option within the existing construct of the welfare system in terms of taking care and long-term planning for Indian children and all children. Does not constitute a new program, and we believe that the numbers as presented do not accurately reflect what would occur with enacting this bill.
Okay, thank you. Is there additional testimony? Will the welfare director, will you stay put? I have some questions for you. Is there additional testimony on the bill? Is there opposition? The program in the analysis does look pretty expensive, especially with the very, very small population that Mr. Cook, whether it's 10 children or 3 children, statewide, it's very small. That is a concern. Also, Mr. Cook, as far as I saw in the committee analysis, one tribe is in formal support. Are there additional tribes? Is this for to resolve a local issue, or why is there not more statewide support?
We do have several tribes. We didn't, and I don't have a list of them right now, but in the previous committees.
Would you get us that list?
Sure.
That would be
we
very
had
helpful.
quite a few witnesses from a variety of tribes that came up here, and obviously.
Tassin is in support, and it's my understanding, as is Siniga. Tassin's 14 tribes.
Very good. So we've got letters from those folks, or?
Yep.
They've resolved to support it. I can't speak for them since I don't work for them.
Okay. Yeah. And then what about the local mandate and the cost of the program per child?
Well, Madam Chair, we currently do already see these children. These are not new children being brought into the child welfare system. We already see Indian children in child welfare, and those counties that have tribal lands within them typically have one person, depending on the size of the county, it may be more than one, who's sort of trained to deal with that. We've worked closely, actually with Senator Ducheney over the last several years, putting together state law that makes clearer what it is that we are to do when Indian children come into our system, to make sure that we work with their tribes, with their families, to try to preserve their ties to the tribe. There's the Federal Indian Child Welfare Act, which is what we operate under, and we actually adopted that now as state law as well, in large part. And so we've not viewed this as a huge new cost, because we do already deal with these children, and quite frankly, historically, not always very well. And so what we've tried to do in working with the Saboba tribe on this bill is to figure out how can we maintain those cultural ties, not but yet still serve the child. So we're trying to balance these two
Very
things. So
good.
we don't view it as a huge new thing.
The committee would really appreciate the additional information on the fiscal issues, and we will put it in the suspense file. If there's any comments, we'll take them now. And in the intervening couple of days, Mr. Cook, let's get that information to the committee.
Thank you, Madam Chair. Some of the data coming in right now was kind of late, and we also want to scrub it. We've obviously got differences of opinion on this. I just want to close, if I very, very quickly, in that this is an issue that's near and dear to my heart as a college professor. You know, I taught about Native American issues and some of the calamities and the tragedies that have befallen Native Americans, and perhaps the greatest is their lack of pride, the fact that they've had to have white man's institutions take care of their kids, and it really, really is something very, very close to me and a lot of other people, and that's why we had the bipartisan support. We are definitely willing to scrub this. As I said, we have different interpretations of math, and obviously I was a historian in political science, not a mathematician. But I would like my statisticians to also look
We'd
at
like to see that information.
Yes.
And we're open to it. If you've got accurate numbers, we'll certainly put them in the report. Did we hear all the public testimony, pro and con? Anybody else? Finance, did I ask you for a comment?
We don't have a file on this measure.
All righty. Then it'll move to suspense. Thank you, Mr. Cook.
Okay.
Appreciate it.
Thank you.
Mr. Hill? Oh, very good. Welcome. You have one item, AB 823 on smog check.
I do, Madam Chair,
Go
and
right ahead.
Senators, thank you. Even though this item 823 is recommended for the suspense file, I wanted to mention a couple of points and bring those to your attention. AB 823 will save the state actually $7 million annually by closing the loophole that currently allows anyone to receive state subsidies to repair their car if they fail smog check, regardless of their income. This bill limits repair program assistance funding to low-income earners. The analysis points out that the Bureau of Automotive Repair's administrative costs for this bill could be $0. That's because the bill only authorizes the Bureau to increase incentive payments for the vehicle scrappage program. It does not mandate those increases. By moving this bill forward, you save the state money and you authorize the Bureau of Automotive Repair to utilize their special fund dollars, those funds that were set aside for this purpose, to get old, high-polluting cars off the road. There's no opposition to this bill.
Thank you, Mr. Hill. You are increasing the amount the state would pay for the polluting cars to $2,000, currently
Correct,
at $1.
but not mandatory. The Bureau of Automotive Repair can do that if they so choose.
The fund only has $2.2 million in it. We would look a lot more favorably on the bill if we left the purchase price the same and kept your reduction in eligibility for vehicle repair assistance. So that would be my suggestion. It's going to suspense anyways. I'm not asking you to take an amendment now, but those are our concerns. So let's hear from your witnesses, and then we'll hear from Finance.
Madam Chair and members, Brian Moss with the California New Car Dealers Association. We're supportive of the bill. The state has been a leader in vehicle retirements, and we think providing BAR with additional flexibility is a good way to go. We support the measure.
Okay. Go right ahead.
On behalf of the Alliance of Automobile Manufacturers, we support the bill and the component of the bill that would authorize the increase to 2,000. We believe it promotes cleaner air, reduced greenhouse gases, and safety. The new vehicles are safer than the older vehicles. There's no question about that.
Alrighty.
And I just
You don't have a concern about the fund balance?
The fund is owed $100 million from the general fund. The reason
no doubt that's going to be coming next week.
It's been borrowed. It's been borrowed for several years. It's an outstanding loan of some duration.
All righty.
We will consider your suggestion, however.
Thank
Senator.
you.
Thank you.
Further testimony in favor? Is there opposition testimony? Finance, do you have a comment?
The provision of the bill dealing with the vehicle retirement, depending on which of the scenarios is actually implemented, because there are several outlined in the bill, The increased cost to BAR's vehicle retirement program would range between zero, if they chose to do nothing, and $30.5 million, of which 17.7 would be paid from the high polluter repair and removal account, and 12.5 million from the enhanced fleet modernization subaccount. The repair assistance provisions of the bill would result in savings to the state of $7.3 million. And then the administrative overhead, based on the projected increase in participation of the vehicle retirement programs, BAR estimates that the administrative costs would be ranging again from zero, if they do nothing, to $258,000 annually. And I would just like to note that the loan to the general fund is $20 million.
Thank you for your accurate depiction of the loan. Members, all the discussion about amendments or not amendments aside, the bill is tagged for suspense. There are significant costs. Without objection, I'd like to move it there. Thank you, Mr. Hill. Appreciate
Madam
that.
Chair.
We'll work on it the next few days.
Appreciate your consideration,
Sergeants,
Senator.
I would like you to remind the Assembly members our intention is not to return after noon. So if they're not here by noon, they're in jeopardy of losing their bills. And members, I think we have to, I'm going to move a little bit faster now with your support.
Doesn't our meeting start at 12?
Beg your pardon?
Doesn't our meeting start at 12?
The floor session starts at 12, Senator
So
Cox.
if they get here at 12 o'clock, that's too late.
That's right. We will end session. We will adjourn this committee at noon and go to floor session. Then there are other policy committees after floor session. We will not be returning to appropriations for the benefit of the Assembly members. Ms. Huber, you're up, and we're going to take them very briefly. All three are items for suspense. First one is State Boards and Commissions Audits, AB 579. If you have witnesses, they can come forward now. Go ahead.
Thank you. And AB 586, I am going to waive presentation on, so I will only have 579 and 1274.
Thank you. Go right ahead.
Thank you. AB 579 requires the state auditor to audit the workload of the members of at least 2 state boards and commissions per year. It further requires that one of those first 2 audits be the Unemployment Insurance Appeals Board. As you can imagine, this bill has changed a bit over.
And the other one is unnamed at this point?
And the other one is unnamed, correct.
And we have an appropriation for that audit. Is there testimony in favor? Is there any opposition testimony? Finance, do you have a comment?
We estimate, the Bureau of State Audits estimates that its annual workload would result in increased costs of $200,000 to $250,000 from the general fund.
All righty, members, that meets the criteria for suspense. It'll go there, Ms. Huber, and we'll work on it for the next couple of days with the help of your staff. AB 1274, Political Reform Act. Go right ahead.
Great, thank you. AB 1274 addresses the need to readily identify who's lobbying on a specific issue by requiring the Secretary of State to display online a breakdown of all lobbying interests seeking to influence each proposed law. And I do have a quarrel here on the numbers that Finance has put to this particular bill. We did have somebody work on doing this project, and it only took 18 hours for one staff person to do an entire quarter analysis of matching up the lobbyists and how much they had spent on each particular bill. So I do quarrel somewhat with the costs that have been attributed to this bill, and I hope that we can work on that as it goes to the Senate Appropriations.
We'll certainly
file.
review your numbers. Is there testimony in favor? Is there opposition testimony? Finance, do you have a comment?
Well, the bill has merit. The Department of Finance is opposed to this measure because it would result in additional general fund costs, excuse me, that are not in the administration's current fiscal plan. The figures cited in our analysis were provided to us by the Secretary of State, in which they indicate that costs could range from $100,000 to $500,000, depending on how it is implemented.
Thank you very much. Members, this is a candidate for suspense. Without objection, it goes to the suspense file. Thank you, Ms. Huber.
Thank you.
Appreciate your timeliness.
Madam Chair?
Yes.
Just one very quick question. You include, how in the world would you know a particular piece of legislation?
That was actually worked out in the Senate Policy Committee, that in the lobbying interests as they're disclosed, the bill number would be included by the lobbyist on how much they're spending lobbying per each particular bill. Therefore, the Secretary of State would only have to pull that data out of the lobbyist form and compile that on.
In other words, you would have to determine for a particular bill how much the lobbyist was spending of their clients' money?
They're already doing that, sir.
Mr. Wyman, the lobbyists would be required to report their time on each legislative item.
Okay.
Okay. So it's in suspense. Thank you, Ms.
Thank you.
Huber. Members, Mr. Arambula's AB 354 has been pulled from the file. We won't be taking that up. Mr. Arambula's bill is two-year bill now. Mr. Price, do you want to take up your item? That is AB 1142. It's a due pass, members. This is on Medi-Cal, proof of eligibility. I see a lot of witnesses coming forward. We're going to take two, and then after that, it's name and position. Mr. Price, go right ahead.
Thank you, Madam Chair, members. AB 1142 addresses a major problem facing many Californians who are wrongfully billed for Medi-Cal services covered by Medi-Cal. For many of these individuals, their lives are turned upside down as they contend with collection agencies that are seeking payments for services covered by Medi-Cal and ruined credit. Specifically, the measure requires hospitals to provide Medi-Cal beneficiaries information to hospital-based providers once the hospital receives proof of a person's Medi-Cal eligibility. It requires the Medi-Cal providers to recall accounts that have been wrongfully submitted to collection agencies for payment, and it requires collection agencies to improve any negative reporting that may impact the credit rating of a Medi-Cal patient as a result of being wrongfully billed. And it requires the Department of Health Care Services to enforce the state regulations and impose penalties for providers who break the law. AB 1142 is a consumer protection bill that protects some of our most vulnerable citizens. Currently, the California Hospital Association is the only opponent on the bill, and we continue to work with the association to address their concerns. I strongly urge your aye vote to this important legislation and have with me the sponsor of the bill, the Western Center on Law and Poverty, represented by Elizabeth Landsberg and Beth Capel from Health Access, as well as others.
Just in the interest of a full discussion, Senator Price, and I apologize for bringing this to your attention at this moment, but we have late information that says the Medi-Cal pays cost-based reimbursement to 95 hospitals that provide Medi-Cal services without a contract. Even if it's as low as $5,000, that would put the fiscal limit for this bill over and above the suspense limit. So,
Madam Chair, you in fact did make my exact point, and that is that there will be increased costs because of this bill, the aspect of Medi-Cal reimbursements to hospitals, because they are cost-based. So they're not staying the same, they're going to go up.
What I would ask, thank you, Senator Cox, and I do agree. Again, it's awkward to bring it up now. What I would say and commit to is that in the next couple of days, you and I can work together to see what can be done about getting more accurate numbers so we both know what the costs are. And we'll work on it together.
Okay, that's fine. My witnesses may have just a few
absolutely.
comments
Let's
to
go
add
to the
that.
witnesses, please.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We are the sponsors of the bill. We've provided the committee with numerous examples of Medi-Cal patients who are billed. When you go to the hospital, you give your CalPERS card to the hospital admissions office, not to your anesthesiologist, not to your radiologist. Those hospital-based providers rely on the hospital to get that information. So we in this bill are trying to work on current business practices, which is that those providers rely on the hospitals for that coverage information. And of course, we've also provided to your staff CMS guidance about the fact that hospitals are currently under legal obligation to make sure both that Medi-Cal patients are seen by Medi-Cal providers and that those patients are not billed. So we're building on current practices to protect our lowest income and urge your support coming off suspense.
Next,
Thank
please.
you.
And this will be the last witness for.
Yes.
Okay, so the.
Madam Chair and members, Beth Capel on behalf of Health Access California. It has been against the law for doctors and hospitals to balance bill Medi-Cal patients for more than 30 years, even longer than I've been working on health care issues. All of the physicians that we're talking about have a relationship with the hospital. We're asking the hospital to tell the doctor that the patient is covered by Medi-Cal. It's a modest bill. We think the costs are wildly overinflated, and there should be actual savings to the state.
If you believe that, Ms. Capel, and have accurate info, please share it with staff. We'll be sure to examine it closely.
Happy to.
And your name and position on the bill.
Yes, Terry Calgar-Hill, representing 100% Campaign in Pico, California, representing the pediatric patients in California.
Thank you very much. Next, please.
Gary Passmore with the Congress of California Seniors in support of the bill.
Next, please.
Kathy Sunderling with the County Welfare Directors Association in support.
Randy
Mr.
Hicks of
Hicks.
Californians for Disability Rights in strong support.
Thank you.
Tim Madden, representing the California chapter of the American College of Emergency Physicians in support.
Thank you.
David Ford with the California Medical Association, just here to report that we are again coming off the bill. We've been a variety of different places, but we are again neutral on the bill as of Friday.
You are neutral on the bill. Thank you. Next, please. Opposition testimony.
Madam Chair and members, Barbara Glazer with the California Hospital Association. We do remain opposed to this bill. We have been trying to work things out with the author, but we're not there yet. Should this bill be enacted, it would require hospitals to hire additional personnel to investigate Medi-Cal patients' files to determine which providers should be contacted and on every Medi-Cal patient to ensure that other providers receive the information. Currently, we have a practice where we try and give our providers the tools to access this information, but with this affirmative obligation, we would have to track and verify all of these notices, and it would require extra personnel to do this. For these reasons, we remain opposed.
Thank you, members. Now, this is a suspense item. Finance, do you have a comment?
On the previous version of the bill, we hadn't identified any significant costs.
All righty. Then with your indulgence, Senator Price, we'll put it in suspense and work with your office in the meantime.
Thank you.
Thank you. Mr. Solario, please come on up. One item, AB 320, county jails, reentry facilities. This, members, is a suspense item. Very briefly, Mr. Solario, we're kind of under the gun.
Oh, very good. Thank you, Madam Chair and members. I'll be brief. This bill is a follow-up to AB 900. We have had some success getting state reentry sites cited in counties, but some counties, large, small, in between, haven't been able to deal with the many strings attached. This is yet another option for other counties to have reentry facilities within existing county jails, just to maximize the number of counties that are doing reentry. Right now, as you know, we have a prison system that's broken. We need to deal with the revolving door. Reentry helps do that. I ask for your aye vote.
Thank you. And your witness, please.
Hi, Melinda McClain on behalf of the Orange County Board of Supervisors. We were one of the counties that were in this situation where we cited within one of our own existing facilities, and we just want this bill to pass so that we would be able to be eligible for funding. Thank you very much.
Thank you very much. Any additional testimony in favor? Is there opposition testimony? Finance, do you have a comment?
I don't have a file on this measure.
Without objection, members, this item will go to suspense. Thank you, Mr. Solario.
Thank
we'll
you,
work with
Madam
you the
Chair.
next couple of days.
Thank you.
Mr. Nava, are you ready? Mr. Nava, you have one item, AB 359. It's a candidate for suspense. If you could give us your briefest possible presentation. Welcome.
Thank you, Madam Chair, and welcome. And thank you for the welcome. This is Assembly Bill 359, digital mammograms. Currently, the Currently, the California Department of Public Health reimburses providers for breast cancer screening under the Every Woman Counts program done by analog mammography only. However, mammography providers are increasingly converting their equipment to digital, leaving large areas of the state without an analog provider. This means that women in some areas must travel over 2 hours to obtain a free mammogram. In my district alone, approximately 2,248 women in the Santa Maria, Lompoc, San Luis Obispo region are impacted by the lack of access to digital mammography. This bill will rectify the situation by requiring coverage of digital mammography screening when analog mammography services are not available from an Every Woman Counts provider. This bill permits the Department of Public Health to reimburse a provider for digital mammography only if the provider agrees to receive reimbursement at an analog rate. Now, the issue that has arisen with respect to the cost, I think I need to address. The mammography services through the Every Woman Counts program are funded through Proposition 99, not the general fund. And through talks with the Department of Health Care Services, I understand the cost to be negligible to add a billing code to this program to accommodate the measure. That's what we're talking about, the addition of a billing code. We have worked hard in the past few months to iron out the details of this bill, and I have witnesses in support.
Thank you. We're going to take two witnesses, so your two best first, then it's names and position.
Yes. Madam Chair and members, Monica Miller on behalf of the County of Santa Barbara, and we're the sponsor of this legislation. There are currently 17 counties that have phased out their analog machines. Therefore, women in 17 counties do not have the ability to get these screenings. This fund is a special fund. There are no general fund dollars in there. So we believe, we've talked to providers. We have 4 providers in the Tri-County region of Santa Barbara County alone that have come to us and said, let us provide the digital screening at the analog rate. However, that's Medi-Cal fraud. So we came up with this legislation in order to address that, to ensure that these women can get the screening. And I know that there was noted in the analysis, there was some concern over this fund running out sooner. But the reality is that these women are eligible for these services, and we should be utilizing the fund and getting these women the necessary services. That's what the fund is intended for. And again, it's a voluntary program. The providers say, yes, indeed, we're willing to eat the additional cost. There's a sunset put on it. We worked with the Radiological Association, Bob Ackerman, very closely to ensure that this is a temporary fix. We recognize the state of the general fund, but it's a temporary fix to again allow these women to get the services that they're eligible for. So we urge an aye vote when it's considered under suspense. Thank you.
Thank you. Next, please.
Chairman Kehoe, Donna Sanderson from the statewide collaborative of Komen for the Cure affiliates. And we find the staff analysis somewhat unconscionable, particularly in the paragraph that says if EWC mammography recipient is diagnosed with breast cancer, would require more treatment and therefore more funds. Well, the whole purpose of the EWC program is to find cancer and to find it early. So it's unconscionable that because we might find cancer and therefore more dollars might need to be spent to treat that person, that's the whole purpose of the program, is to keep people living.
We do understand the importance of the bill. The purpose of the analysis is to identify the fiscal implications. It's done very conscientiously, very conscientiously. So we're here to address those fiscal issues, and appreciate your comments. Next, please.
Gary Passmore with the Congress of California Seniors in support.
Next, please.
Alice Schneid, Vice Chair of the Public Policy Committee, California, Komen for the Cure.
Thank you.
In support.
Nicole Wertelman on behalf of the City and County of San Francisco in support.
Thank you. Mr. Noteware.
Good morning, Madam Chair and members. I'm Fred Noteware, and I represent Organized Oncology, the cancer physicians in support.
Very good. Any other testimony? Is there opposition testimony? Finance, do you have a comment?
The bill would result in the Department of Public Health exhausting its appropriation authority earlier in the fiscal year as compared under current law, assuming no other programmatic changes are implemented to offset this additional cost. So, and then we have just a concern that because the funding for the Every Woman Counts program depends on the level of tobacco surtax revenue, which is a declining revenue source, any increased costs resulting from the bill could create a general fund cost pressure.
Thank you. We certainly understand that the more women that are screened, the more lives will be saved. That's a benefit to the state, both fiscally and ethically. Nevertheless, there is a complicated trail of funding here. The finance scores some of it as general fund also, Mr. Nava. So it will go to suspense, and we'll work with your staff to do as much as we can between now and Thursday.
All we ask is an opportunity.
Ms. Oropeza.
Madam Chair, I'd just like to say that I hope that this measure is positively considered in committee. Given the most latitude, this is a very important issue, and also it appears there's more than one way to look at the costs, as what mentioned by the witness, and I think she made some appropriate comments.
Very good comments, Senator Oropeza, and we will look at it very, very carefully. Thank you.
Thank you, Madam Chair and members.
Ms. Caballero is here, and to the sergeants, the members that need to have bills voted on include Mr. Jones, Mr. Mendoza, and Mr. Cotto will be, Mr. Price, you're presenting for Mr. Cotto. Well, Mr. Cotto's off the hook, but we will be adjourning at noon. Ms. Caballero, thank you for joining us. Your most succinct presentation would be appreciated.
Thank you very much, Madam Chair and members. I'll take up the first bill is AB 856. AB 856 will ensure the integrity of the California organic produce industry.
Madam Chair, I would move this bill.
Sounds like a motion to me from Senator Cox, our Vice Chair. This is as amended, Mr. Cox. May we go to your witnesses?
Yes, we may.
And two, please, and then after that, it's just the name and your point of view.
Members, thank you. Carla Sanchez, Department of Food and Agriculture. We are the sponsors of the bill. We thank Assemblymember Caballero for authoring this legislation. We ask for your support.
Thank you. Next, please.
Pete Price, Community Alliance with Family Farmers, in support of the bill.
Thank you.
Renee Pinnell on behalf of the Western Plant Health Association, in support.
Thank you.
Steve Beckley on behalf of Organic Fertilizer Association of California, in support.
Thank you very much. Is there any other testimony in favor? Is there opposition testimony? Finance, do you have a comment?
We don't identify any costs as a result of this measure.
Very good. Senator Cox made a motion without we will call the roll first.
Kehoe?
Aye.
Kehoe, aye. Cox?
Aye.
Cox, aye. Corbett? Corbett, aye. Denham?
Aye.
Denham, aye. Hancock? Hancock, aye. Leno?
Aye.
Leno, aye. Oropeza? Oropeza, aye. Price?
Aye.
Price, aye. Runner? Walters? Aye. Walters, aye. Wolk? Wolk, aye. Wyland?
Aye.
Wyland, aye. Yee? 11-0.
Thank you. Sergeants, we need Senator Yee and Senator Runner, please. Thank you for your help. That bill is out, though. That bill is out.
Thank you very much, Madam Chair.
Ms. Caballero, you've got one other item.
I do.
1052. Go right ahead.
1052. Thank you. AB 1052 requires the Department of Fish and Game to implement the recommendations made by the state auditor in his October 2008 audit.
Ms. Wolk makes a motion on that bill. Should we go to your witnesses?
Yes, we may.
Thank you.
John Beutler on behalf of the California Sport Fishing Protection Agency and our 40 affiliated fishing groups across the state. We strongly support the bill.
Very good. Next, please.
John Rozanich, Bay Delta Sport Fishing Enhancement Stamp Vice Chair and representative of the Allied Fishing Groups. We're here to show our support for this bill also.
Very good. Next, please.
Jeff Shalato speaking for Cal Trout, in support of the bill.
Any other witnesses? You got one more back there.
Good morning, Madam Chair. Jason Ryan, California Under Heritage Alliance. We are also in support.
Thank you. Any additional support testimony? Is there opposition testimony? Finance, do you have a comment?
The year-end balance in that account is estimated to be $5 million, and due to this balance, the Department of Fish and Game will be able to continue the program for 2 years without new revenue.
Very good. We have a motion by Senator Woke, and we'll call the roll.
Kehoe?
Aye.
Kehoe, aye. Cox?
Aye.
Cox, aye. Corbett? Aye. Corbett, aye. Denham?
Aye.
Denham, aye. Hancock? Aye. Hancock, aye. Leno?
Aye.
Leno, aye. Oropeza? Oropeza, aye. Price?
Aye.
Price, aye. Runner? Walters?
Aye.
Walters, aye. Wolk?
Aye.
Wolk, aye. Wyland? Wyland, aye. Yee? 11-0.
11-0, that bill is out.
Thank you, Madam Chair.
for being
Thank
so
you.
timely, Ms. Caballero. Members, we're going to go to waive presentations and see if we can get through a few of those. We have had additional letters delivered to us during the hearing. So we're starting with Mr. Huffman, AB 234. Members of the public, I'm going to call out the bill name. If you have testimony on the bill, come right up. AB 234 by Mr. Huffman, having to do with energy and the federal stimulus funds. Is there testimony in favor? Is there opposition testimony? Finance, do you have a comment?
We estimate costs to the state to be minor and absorbable.
That goes to suspense. Next item is Assemblymember Bass, very similar to the Huffman item, AB 262. Is there testimony in favor? Is there support testimony? Seeing none, Finance, do you have a comment?
We also believe that costs would be minor and absorbable.
All righty, that goes to suspense. Mr. Fuentes, Physicians Health Program Act. The Physicians Health Program Act, AB 526. Is there testimony in favor? Is there opposition testimony? Please come right up.
Laura Zuniga with the Department of Consumer Affairs. The department is in opposition.
Thank you very much. This is to suspense without objection. Finance, did you have a comment on this?
Consumer Affairs estimates that the bill would result in increased costs of $1.2 million, and the bill would increase license fees and license renewal fees by $22 million to support it.
Let's see. Thank you. That goes to suspense. Next, we have AB 744 by Mr. Tirico. This is the toll lanes in the Bay Area Express Lane Network. Is there testimony in favor? Is there opposition testimony? Is there Any testimony on Mr. Tirico's AB 744? Please come up.
Members, Mark Watts, representing Santa Clara Valley Transportation Authority, in favor of this measure. Encourage support coming off suspense.
Thank you. Any other testimony on AB 744? Yes.
Well, support was going to come up. Michael Endicott with Sierra Club, California. We're in opposition to this measure currently, but we're trying to work with the author to work out some of the issues.
Thank you. Any additional testimony on 744? Without objection, then, Finance, did you have a comment? Okay, no file from Finance. It goes to suspense. Mr. Mendoza, thank you for joining us. AB 943 on employment credit reports. This is a due pass, members. As brief as possible. Thank you.
Madam Chair, this bill would ban the use of pre-employment consumer credit reports. Employers do not need to have access to applicants' personal financial information in order to evaluate their work ethic and trustworthiness. Thank you.
I move the bill.
Mr. Leno moves the bill, and do we have some testimony?
Madam Chair and members, Caitlin Vega for the California Labor Federation. We think that there are many things that are far more accurate about whether someone will be a good employee than the use of their credit score, especially at a time with mass layoffs and foreclosures. People's credit scores really have nothing to do with whether or not they are responsible, hardworking, and will be good employees. We think references are much better for that. We're here in support. Thank you.
Thank you. Additional testimony in favor? Opposition testimony? I see you in the blocks there.
Madam Chair and members, Mike Belote for the California Employment Law Council. We think this is an excellent way to not spend $60,000 to $120,000 of either DLSE resources or an assessment on employers. This is a management prerogative that is going to lead to more litigation at exactly the wrong time in the California economy. So we would ask for a no vote.
Thank you. Yes, sir. Go right ahead.
Jerry Desmond, Jr., on behalf of the California Association of Licensed Investigators, opposed to the bill. The importance of this information is shown by the exemptions that are being made for law enforcement and the Department of Justice, and we believe that there are other situations that are just as valid, and we oppose the bill.
Thank you. Thank you. Any other testimony on Mr. Mendoza's AB 943? Finance, do you have a comment?
We believe that the bill would not have a fiscal impact on the state, and we are neutral on the measure.
Mr. Weiland.
Just briefly, Madam Chair. Employers would not spend money on this if they didn't believe that it were relevant to job performance. And having been an employer who, in some occasions, got driving records, for example, consistently because it had an effect on our employees, I can tell you that this constraint upon employers is not going to achieve what it's intended to do. Employers just aren't going to spend the money if they don't need to.
Thank you, Mr. Weiland.
Madam Chair, I am one who believes that this provides early warning for the it's an early warning for the employers. The employer gathering data has the opportunity to go to an employee and say, look, it looks to us like you're in some sort of trouble here. Is there anything we can do to be of assistance to you? And or is it a situation that you've got yourself so far in that you can't get out? It really does, in fact, have to do with the kind of business that you're running. Mr. Mendoza, I hate to tell you this, but this is another one of those NUMMI bills that create absolute havoc for the business community in the state of California. And if you believe that the business community is thriving and that people are not leaving, business are not leaving the state, I've got news for you. I don't think you believe that. But this is a classic NUMMI bill.
No, thank you for your comments, but I must obviously not agree. This is for applicants, not existing employees. So this is for applicants. And we also give businesses, we say that they can actually do a credit check report if it's substantially related to their job or where the applicant or the promotion candidate would have access to money, assets, or confidential information. Financial information. So we have some exceptions for businesses. But we're talking about just rank and file workers, that people who will go and apply for just rank and file jobs. Why do they do the credit score, the credit report? It makes no sense.
Because it provides early warning, Mr. Mendoza.
For a person that's going to stock the shelves?
Doesn't make any difference what the job is.
Well, I respectfully disagree. I think
we have a disagreement there.
Yes, sir. Thank you.
Thank you. Members, I think this bill strikes a balance between privacy protections for the average guy that's applying at any kind of business versus where a credit report would be critical to the nature of the job, whether it's Department of Justice or a public agency, et cetera. So are there any further comments? Did I ask Finance for your comments? All righty. Do we have a motion on the bill?
We do.
Senator Leno, and we'll call the roll.
Kehoe?
Aye.
Kehoe, aye. Cox?
No.
Cox, no. Corbett? Aye. Corbett, aye. Denham? No. Denham, no. Hancock? Aye. Hancock, aye. Leno?
Aye.
Leno, aye. Oropeza? Oropeza, aye. Price?
Aye.
Price, aye. Runner?
No.
Runner, no. Walters? No. Walters, no. Wolk? Aye. Wolk, aye. Wyland? Wyland, no. Yee? Aye. Yee, aye. 8-5.
8-5, that bill is out. Thank you, Mr.
Madam Chair.
Mendoza.
Thank you, member.
Members, as long as we have, I think, a full house here, there's a couple that are on call. How many? Three. There are 3 items on call. Sally will announce the bill, the author, the title of the bill, the chair, and the vice chair.
AB 483 Buchanan. Do pass. Chair is aye. Vice chair is no.
Call the absent members, please.
Hancock? Hancock, aye. Oropeza? Oropeza, aye. Price?
Aye.
Price, aye. Wyland? Yee? Yee, aye. Wyland, no.
And Yee?
8-5.
You got Mr. Yee.
Yes.
Very good. 8-5, that bill is out. Next.
AB 517 by Ma. Do pass. 5-2. Chair is aye. Vice chair is no.
This is the safe body art the tattooing.
Denham?
Please call the absent members.
Denham? Hancock? Aye. Hancock, aye. Leno?
Aye.
Leno, aye. Oropeza? Aye. Oropeza, aye. Runner? Wyland? 8-2.
8-2, that bill is out. And the last one that's on call.
AB 730 by De La Torre. Do pass. 6-4. Chair is aye. Vice chair is no.
This is penalties on health insurance companies.
Hancock? Aye. Hancock, aye. Oropeza? Aye. Oropeza, aye. Wyland?
The vice chair
Is
is
no.
a no.
Wyland is no. 8-5.
8-5, that bill is out. We will go back to waiving presentations, and the next one up is Ms. Hubers. She passed on that when she was here. To the public, this is AB 586 on public employees and their medical conditions. Is there testimony in favor? Is there opposition testimony? And then we'll go to finance. This is a suspense items. Your name and go right ahead.
Thank you, Madam Chair. Senators, Julianne Broyles here on behalf of the California Association of Joint Powers Authorities. We understand the bill is proposed to be amended, and we have sent the bill back for review by our by CJAPA's legislative policy committees. However, we are concerned about the extension of presumptions in a general fashion and would ask for a no vote on the bill.
Thank you.
Madam Chair, members of the committee, Michael Corbett with the CSAC Excess Insurance Authority. We had an opposed position on the bill in its previous version. We have not yet reviewed it as proposed to be amended, but as was previously stated, we too have a general opposition to the extension of presumption measures.
Members, there are authors' amendments that bring this bill back to University of California and California State University, police and fire employees only. Those will be the upcoming amendments. This is a suspense item. Is there finance? Did you have a comment?
The Department of Finance is opposed to this measure. Broadening the eligibility for use of the presumptions would result in significant but unknown state costs.
All righty. Without objection, then it goes to suspense. Our next item is Julia Brownlee. This is AB 627 on child care nutrition. Is there testimony in favor of AB 627? Testimony in favor. If there's opposition testimony, you can also come up. Go right ahead, please.
Nicole Wortelman on behalf of the City and County of San Francisco in support.
Thank you. Next, please.
Chad Silva on behalf of Latino Coalition for Healthy California, and support.
Very good. Any other testimony in favor or opposed? Finance, do you have a comment on 627?
We believe that it is likely to create cost pressures for the state to add Proposition 98 General Fund resources to the Child and Adult Care Food Program.
All righty. Thank you very much. Without objection, that item will go to suspense. We have now Ms. Hayashi, State Highways, AB 1386. Is there testimony in favor?
Madam Chair, members, Mark Watts representing the City of Hayward. Passage of this bill will bring to a close 40 years of uncertainty in the City of Hayward and provide some significant relief to the tenants in the former corridor. Urge your aye vote.
Mr. Watts, and to the staff for AB 1386, had a very similar situation in my city council district years ago. I want to know what the disposition is going to be of local residents and homeowners in this right-of-way, okay?
Now?
No, not now.
Thank you. Yes, I can combine review on that.
If you could get back to the local,
yes.
is it a city or a county or whatever,
Yes.
I'd like to know what they're planning to do.
I will do that.
Thank you very much. That goes to Finance. Did you have a comment?
There would be one-time costs to Caltrans to bring these sections of road into good repair. We are neutral on this measure.
Very good. Thank you very much, Finance. That item, AB 1386, goes to suspense. Members, Mr. Blumenthal-Field next on the agenda, AB 1390. That is going to the floor relative to Rule 28.8. So that bill is dispensed with 1390. And Mr. Jones? Mr. Jones, you're going to take up all three? Yes, Madam Chair. As briefly as possible, Mr. Jones.
Yes.
We're trying to get out by noon.
Of
In fact,
course.
we will get out by noon.
Yes.
AB 786, health coverage, choice categories.
Yes, Madam Chair, members, I'm very pleased to accept the amendments recommended by the committee, clarifying that out-of-pocket costs will not include premiums for purposes of the maximum limit in the bill, correcting a typo, and I'd also like to add Senator Steinberg as the principal co-author of the bill. The principal purpose of this bill is to try to make things easier for consumers. It requires the departments to organize existing products into 10 categories, sets an out-of-pocket max, and also requires that standard definitions be used so consumers know what they're getting. The bill is a result of ongoing negotiations. We're continuing to have discussions to try to narrow down the existing issues. We've taken language requested by the administration, and my hope is that we continue to move forward with this bill. We have some witnesses who would like to speak on behalf of the bill.
Go right ahead.
Madam Chair and members, Beth Capel on behalf of Health Access California, the sponsor of this measure again this year, as we were the sponsor of Senator Steinberg's similar measure last year, which passed out of this committee. This bill is an important consumer protection bill. It says that no one will ever, who buys health insurance, will ever face costs in excess of $15,000. That seems like a lot of money, but given the existing insurance market, it's an improvement. It would also provide consumers substantial information so that they're able to better comparison shop. We recognize that there are costs associated with this bill, but they are all special fund fee supported. We appreciate the committee's
Next, please.
Madam Chair, members of the committee, Gary Passmore with the Congress of California Seniors. Like Health Access, this is a piece of legislation that we have supported for a number of years in this legislature. Frankly, the individual insurance market has been correctly characterized as the Wild West of insurance markets. Right now, consumers are entering at their own risk. This would help regularize the information, eliminate junk insurance, and we strongly support this measure.
Thank you. Next, name and position on the bill.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty and Support.
Thank you very much. Next.
Randy Hicks with Californians for Disability Rights and Strong Support.
Next, please. Sir. Your name and position on the bill.
Jerry Gonzalez in support for AARP.
Thank you very much.
That would be the insurance portion of AARP?
Ma'am, the AARP, can you come back to the mic, please? You have a question from Senator Cox.
Is that the insurance portion of AARP that supports this bill?
It's our 40 million members. We have a lot of seniors.
Oh, so it's not, insurance portion's not the one that that supports this then?
I'm not sure. I would have to check into that.
Okay.
I wasn't told that, sir.
All right. Thank you, ma'am.
Thank you. Mr. Weiland.
The reality is that this would drive up insurance costs dramatically. What you're talking, the Wild West, would mean more and more and more in the individual market would not get coverage. I absolutely do not believe that if the members of the AARP had any inkling of the implication of this, they would support it. Those who have insurance to cover things that aren't covered by Medi-Cal, they would be unaffordable to most of them. It sounds like a good idea, but the bottom line is, it would be unaffordable. The underwriting would change absolutely dramatically.
Thank you. Is there additional comments we've had in favor? Is there opposition testimony?
Madam Chair, members, Stephen Lindsay with the California Association of Health Underwriters. I represent the folks who sell health insurance. And the difficulty with this bill is that as the regulators attempt to put very diverse products into categories, our belief is that they will not be able to create something that is useful for the consumers, and it will cost them a couple of $1 million to get there. And I'll give you an example of that. You could have a product with a $3,000 out-of-pocket and a product with a $5,000 out-of-pocket in the same category. And we believe, and because the benefits are structured differently inside those, we believe that that just confuses consumers when they go to product or to Category 4 or Category 5 to look for a product. There will be no consistency amongst the products within any of the categories. We believe the money could be spent much better in other ways. Thank you.
Jason Gabbard with the Association of California Life and Health Insurance Companies, also in opposition.
Thank you. Additional testimony opposed? Finance, do you have a comment?
The Department of Insurance estimates one-time costs of $510,000 to develop the regulations and ongoing costs of approximately $1 million for additional insurance policy filing review. The Department of Managed Health Care estimates first-time costs to be $1.8 million and needing 5.7 positions. Ongoing costs would be approximately $360,000 with 3.6 positions.
Thank you. Members, any comments? This is a candidate for suspense. Without objection, that will go to the suspense file, and we will move on to 1521.
Madam Chair, this bill is sponsored by Health Access. It enacts consumer protections and compensation arrangements between health insurers and brokers and agents. We've worked this out with the insurance industry and the brokers and agents so that there is no opposition. On the fiscal, we do believe that the Department of Managed Health Care has presented to your committee a fiscal analysis based on a very aggressive, proactive enforcement of the measure. The measure itself doesn't speak directly to enforcement. We believe that people will act in good conscience and follow the dictates of the measure, and we're not anticipating much, if any, complaints regarding noncompliance. It's a very simple, straightforward measure that sets up some ground rules for making sure that consumers have some understanding of the relationships between the brokers and agents and the insurers, and incentives to try to essentially disincentivize churning of products to the disadvantage of consumers. And again, we have no opposition to the measure.
Very good. Witnesses?
Beth Capel on behalf of Health Access California. 2 points. Again, to note that there is no opposition to the measure, that we are trying to protect consumers by assuring that, as is existing practice, brokers and agents are not paid more for steering healthy people to insurance companies. Second, that the costs that you have... Yes, sir.
That doesn't occur.
It has occurred in other states, Senator.
Doesn't occur in California.
That is our understanding, and for once we'd like to protect consumers before harm is done rather than after the fact. There is evidence in other states of this occurring. It is why we were, after considerable discussion, able to reach agreement with both the health underwriters as well as the insurers and HMOs.
There isn't any difference, by the way, in a renewal commission and a new commission. You're not paid more money for moving an account from one place to another. Matter of fact, you may very well receive less money than you do.
We were pleased to discover that that was already the case in California.
That's the author's. The author states in some form of his discussion with the committee, which we have in our analysis, that the author says that agents receive greater commission when you churn the business. That just doesn't happen to be true.
That happens not to be true at the current time in California. This bill will assure that it is never true.
It has happened in other states, and that's what we're trying to prevent.
With respect to the cost, just to note, as the author did, that this assumes that the Department of Managed Health Care would aggressively...
I think Senator Cox has finished his statement.
Yes.
Have you finished yours?
Yes, ma'am.
Okay. Next, please.
Gary Passmore, Congress of California Seniors. We strongly support this bill.
Next, please.
Randy Hicks. Randy Hicks, California Alliance for Retired Americans, and strong support.
Thank you very much. Any other testimony? Is there opposition testimony? Finance, do you have a comment?
The Department of Managed Health Care indicates that it would incur first-year costs of approximately $410,000, second-year costs of $348,000, and just the Department of Mental or Managed. I keep wanting to do mental health care. The Department of Managed Health Care has not provided us with an estimate for enforcement costs.
Thank you. Members, this is a candidate for suspense. Unless there's further comment, it'll go to suspense without objection. Mr. Jones, your last item. This is a due pass, members, 1540.
Madam Chair, Senators, this is the annual omnibus health cleanup bill.
Madam Chair, I take great pleasure in moving Mr. Jones's bill.
This indeed is a momentous moment. I want to just note that. I want to thank the Senator for moving the measure. Thank you.
You're welcome. Do you have any witnesses in favor?
Thank you, Dave.
Sarah Logue from the California Department of Public Health. We are the sponsors of the drinking water provisions of the bill and support. Thank you.
Further testimony? Is there opposition testimony? Finance, do you have a comment?
The Department of Managed Health Care estimates that the bill would create one-time costs of $168,000 to the Managed Care Fund and would require 1.4 positions.
Members, we have a motion by Senator Cox. If there's no further comments, we'll call the roll, please.
Kehoe.
Aye.
Kehoe I. Cox.
Aye.
Cox I. Corbett. Corbett I. Denham. Denham I. Hancock. Hancock I. Leno.
Aye.
Leno I. Oropeza. Oropeza I. Price. Price I. Runner. Runner I. Walters. Walters I. Wolk. Wolk I. Wyland. Wyland I. Yee. Yee I. 13-0.
13-0.
Thank you, Madam Chair.
That's the high point of the day, Mr. Jones.
For me as well. Thank you very much.
Members, let's go to the final item on the file because that's the only other due pass. This is Mr. Cotto's bill AB 1577 on problem and pathological gambling, and Senator Price was kind enough to present it. Please go right ahead.
Thank you, Madam Chair. AB 1577 expands and brings consistency to the state's efforts to have a positive impact on problem gambling.
Senator Cox moves the bill.
Thank you.
Would you like to give us a sentence on the bill?
AB 1577 provides that the Office of Problem Gambling may create a plan that expands on existing work aiming at more prevention and bringing greater consistency to OPG's efforts.
Thank you.
There's no call for new money, no opposition, and I respectfully ask for your aye vote.
Thank you, Senator Price. Is there public testimony on item AB 1577? Any in support? Any in opposition? Finance, do you have a comment?
No file.
Motion by Senator Cox. We'll call the roll, please.
Kehoe.
Aye.
Kehoe I. Cox.
Aye.
Cox I. Corbett. Corbett I. Denham. Denham I. Hancock. Hancock I. Leno.
Aye.
Leno I. Oropeza. Oropeza I. Price.
Aye.
Price I. Runner. Runner I. Walters. Walters I. Wolk. Wolk I. Wyland. Wyland I. Yee. Yee I.
13? Mr. Cotto has 13 votes. That bill is out.
Thank you.
Thank you, Senator Price. Members, we have 2 items to go. AB 1175 by Mr. Torlakson. He is waiving presentation. This is on toll facilities. Is there any public comment on AB 1175?
Madam Chair, members, Mark Watts, representing the Contra Costa Transportation Authority. We're In support of this measure, it will bring the last 2 bridges in the Bay Area into the seismic safety program and urge your support.
Very good. Is there opposition testimony? Finance, do you have a comment?
The bill would shift $950 million in retrofit work from Caltrans to the Bay Area Transportation Authority, with Caltrans relinquishing its share of funds from the overage account. And it is unknown that the recovery amount would be as a result of this bill.
Members, this is a candidate for suspense unless there's further comment. It will go to the suspense file. And our final item today is Mr. De Leon's AB 1449 on solicitation for health coverage. Is there any testimony in favor of AB 1449?
Randy Hicks with the California Association of Retired Americans in strong support.
Thank you. Any other testimony in favor? Is there opposition testimony? Finance, do you have a comment?
We are neutral on the measure and believe that it would result in minor and absorbable costs.
Without objection, then, members, seeing no further comment, it'll go to suspense. Do you have all the items, everything's taken care of?
I think so. I think that puts us through everything,
Yes,
doesn't it?
that does. Members, that concludes the file. This meeting is adjourned.